This is Al Jazeera.
And a very warm welcome from me, David Foster, to this Al Jazeera News Hour. These are the stories we're covering in detail in the next 60 minutes. Syria's secret medical supplies. We follow the activists risking it all to help the hurt. Sudan's forces accused of bombing South Sudan as the government in Khartoum rules out new peace talks. France's president looks to the right wing to stay in power after defeat in round one of the election. And South Korea tries to tackle the ugly side of politics with a new law to stop punching in parliament. Syrian opposition activists face mounting challenges as they try to treat injured fighters and civilians while under attack. They've smuggled entire field hospitals into Syria and developed a secret network to bring in supplies, and they are risking everything to do it. Al Jazeera's Anita McNaught has this exclusive report from Idlib province in Syria.
For 9 months, their work's been carried out in secret to protect the warehouse and its supply lines. In a small Turkish town near the Syria border is the coordinating center for medical equipment and drugs to treat the sick and wounded of the Syrian uprising. They've just been officially licensed by the Turkish government. For the first time, they're moving 2 entire new field hospitals into northern Syria, paid for by donations from Syrians living overseas.
The turning point was Bab Amr massacre. It really turned the hearts of many Syrians in the United States. They were doing a lot of things before Bab Amr on individual basis and some community basis as well. But after the Bab Amr, you could feel the escalation.
It's no easy task smuggling this quantity of equipment into a war zone. We know how they do it. We've been asked not to reveal this information to protect their roots. And this is where the field hospitals come to. This is the halfway point on the porch of an unremarkable house in a small town somewhere in northern Syria. Here the field hospitals are resorted, reassembled and taken secretly to the towns that need them. One of those is Sarmin, a largely pro-opposition town in northwest Idlib province. On the 22nd of March, the Assad army rolled in as part of its crackdown on the uprising, putting tank shells into shops and houses and the minaret of a historic mosque, demolishing homes of opposition supporters, leaving at least 18 people dead. As the fighting raged around the narrow streets of the old Medina, this doctor was trying to tend the wounded in a makeshift hospital.
We had many injured come in that day, about 25 to 30. We carried out emergency first aid and sent them to a safer location. The Syrian army was very close and we were forced to evacuate this place. After we returned, we saw the whole clinic was burnt.
Dr. Suleiman, not his real name, is a member of the Free Syrian Doctors Movement, a secret association of medical professionals whose decision to treat opponents of the Syrian government, civilians as well as fighters, places them in great danger. So far, 4 doctors are believed killed, 25 are in prison, hundreds of others have been arrested.
Some of our friends was killed with blood, cold blood. Some of our nurses also. Doctors want to do their job without thinking in politics. We must to help people, we must to help our people, and we will do that in any way.
No matter what side?
No matter.
Please, what was all of this? The Syrian army went through the field hospital that day, burning everything they found. Antibiotic. All destroyed.
Antiseptic.
Their secret location blown, the building trashed, the operation's been moved to another part of the city, restocking with new essential medical supplies. These clinics provide the only safe access to medical care for people in these resistance towns. Public hospitals are off limits to anyone Syrian security forces suspect of being part of the uprising. In the shopping district of Sarmin, the army attacked, vandalized and looted every single pharmacy. Only one of them had stock left to reopen, and much of that is damaged, salvaged from the violence. The international community has not acted to bring in any kind of humanitarian corridor for the people of these towns. Smuggled medical equipment from Turkey is the only help from the outside world that's reaching them. They're grateful, but they told us it's not enough. Anita McNaught, Al Jazeera, Sarmin, Idlib province.
So let's talk now to Amar Wakaf in London, a member of the Syrian Social Club, a UK-based group which supports the Assad government. Very good to have you on this news. Can I read to you the words of Marie-Pierre Allier, who's head of the group Doctors Without Borders, Médecins Sans Frontières, who says medicine is being used as a weapon of persecution. And these health professionals, doctors, nurses, other people, would seem to agree with that. Do you?
Well, obviously, the people, the militants who oppose the government, obviously they don't want to go to government-held or even private-held hospitals because probably they have some arrest warrants to their names. I mean, the German news magazine Der Spiegel interviewed one of those people in Tripoli in Lebanon whose job was no less than slitting people's throats. He was part of what is called the burial brigade. So those people won't find it safe very much to go into public hospitals, and they would definitely need, when wounded in clashes with the government forces.
But we're not just talking about opposition fighters here, we're talking about civilians, people who have no part in the conflict.
Well, yes, civilians do get wounded and even killed as part of the operations that are taking place, obviously, and that's very much regrettable. However, part of the problem is that those militants won't allow humanitarian aid that is sent by the government to reach the people or the civilians who are under their control. I mean, ambulances were shut out many times and so on and so forth. So it's really... there is another issue here. I've seen your report. It pretty much says that we need to send all these humanitarian aids. I mean, any additional humanitarian or food supply is very much welcomed by the Syrian government, perhaps. But in a sense, Syria produces everything, and if there is basic food that is needed, it doesn't have to come from France, you see. All that is needed is somebody who has a word with those militant groups to allow this humanitarian aid in through the Syrian Red Crescent and the International Red Cross. I think that's our problem.
What would these doctors do? Because they're not really part of the conflict, are they? Well, what should they do besides try to help in this fashion?
Well, I would encourage them to do their job as best as possible, but again, you know, inevitably they're helping people with blood on their hands, the people who have decided to take the armed struggle way against the government, and these people are pretty much supported by, you know, outside countries who have pledged publicly to fund and support them with arms.
But you saw the story, didn't you? You've just said as much. You know, when we have pictures there of a field hospital where medicines have been burnt, where other supplies have been burned. Why is there no respect from those who are taking on the militants for simple health care?
Well, basically, it's going to take more than a pious-looking doctor to convince me that all that I am seeing is pretty much true. I don't know what's in their boxes. I don't know how. What about the other boxes that Al Jazeera international crew was never, invited to
What do you think might be in them?
What is being smuggled over the border is clearly more arms than medical aid. And that is a worry for the Syrian government. And if I were in their shoes, I would pretty much want to know exactly what's in those boxes. And if I am going to donate any money to any, under the banner of, let's just help those people who are wounded in Syria, I would very much want to ask where my money is going. Is it to buy more weapons in order to kill more people in Syria, or is it going really to help some people to not lose their lives in Syria? I would definitely ask that question.
Appreciate your time. Thank you very much indeed.
Thank you very much, sir.
The President of Sudan